It should be very clear to the American people that President Trump has initiated not only a whole of government approach, but a whole of America approach. And the President's interaction even today and through the course of this day with leaders in industry around the country reflects that we're not only bringing the full weight of the federal government to bear, but the full weight of the American economy. And I know I speak on behalf of the President when I say how inspired we are at the way the American people have stepped up and the way that American businesses, large and small, have stepped up. It's truly been inspiring. Our task force met this morning. We continue to focus on President Trump's priorities of testing, prevention, and supplies. And in that category, I'm authorize labs in their state and expand existing testing capabilities. But also in connection with the FDA's action, which you'll hear more about in a moment, we now have continued to expand the public and private partnership that the President forged with vast commercial laboratories around the country, increasing access to the high-volume, high-throughput coronavirus testing that is greatly expanding access even as we speak. Also, our task force received a report this morning on the progress that the U.S. Public Health Service and FEMA are making, working closely with state governments and also partners in the private sector like CVS, Target, Walgreens, and Walmart to expand remote testing sites around the country. And we'll have a full report later this week as those come online. It's important the American people understand that testing is happening all over the country. But all of our health experts wanted me to tell the American people, you don't need the results of testing to know what you should do. And President Trump's 15-day coronavirus guidelines are advice for every American in every community. They're the result of the best guidance of CDC and our health experts. And as the President said, we continue to urge every American over the next 15 days to put into practice the principles in the President's coronavirus guidelines. By every American practicing these principles, we believe that we can slow the spread of the coronavirus. In fact, our experts have told our task force that if every American acts on the President's coronavirus guidelines, we could see a substantial reduction in the spread of the coronavirus. But as the President said, it will take all of us to do it. So if you feel sick, stay home. If someone in your house tests positive, keep the entire household home. Especially if you're a person with an underlying health condition, we urge you to stay home and practice social distancing from people. No social gatherings of more than 10 people. Use drive-through, as the President discussed with leaders in the industry today, and every American, especially practicing common sense and good hygiene. For the American people as a whole, the risk of serious illness remains low. But we're asking every American to partner with us in this effort to slow the spread of the virus and especially to be mindful of seniors or others with serious underlying health conditions for whom the threat of the coronavirus can be very significant and very real. As I said, the President has continued to push our task force to bring a whole of government, a whole of America approach. And we continue to be inspired the way our nation's governors and nation's businesses are responding. We spoke just yesterday with the leaders of every broadcast network in America that will soon be unveiling a public service campaign using CDC guidelines. And specifically, as we work on the issue of supplies, meetings yesterday with Department of Defense officials about excess supplies. The President and I will be meeting today to speak about the supply chain for hospitals. We would make one specific request, and that is we would urge construction companies to donate their inventory of N95 masks to your local hospital and forego additional orders of those industrial masks. Because of what the President asked to be included in legislation moving through the Congress today, those industrial masks that they use on construction sites are perfectly acceptable for healthcare workers to be protected from a respiratory disease. But we're asking construction companies that our President knows very well from his background, we're asking them to donate their N95 masks to their local hospitals and also forego making additional orders. At the President's direction, we will continue to do whatever it takes. We'll continue to marshal the best of the American people, the best of all the people behind me, the people behind them, our state and local officials, and we will get through this, and we will get through this together. Thank you, Mr. President.
I'd like to announce some very significant actions that the President has approved today. The first I would say is earlier today, I sent a letter to Fed Chairman Powell approving his request to use 13.3. And what that will do is the Fed will be setting up a special purpose vehicle, which the Treasury will invest $10 billion in from one of our funds. That will enable the Fed to guarantee the purchase of A1, P1 commercial paper going forward. That is a $1 trillion market and is critical to American workers, it's critical to American business, and it's critical to American savers who have a lot of that money in money market funds. So we heard loud and clear there were liquidity issues. This is very significant and will create, I don't think we'll need to use it all, but we have the ability to have the Fed purchase up to $1 trillion of commercial paper as needed. That has already created significant stability in the market today. The second thing I would say is, we've previously talked about deferring IRS payments. The President earlier this morning authorized me to announce this program. I have previously announced we would defer $200 billion. The President suggested we increase that to $300 billion, which we will be doing. Now, let me just be clear on the specifics. We encourage those Americans who can file their taxes to continue to file their taxes on April 15th, because for many Americans, you will get tax refunds, and we don't want you to lose out on those tax refunds. We want you to make sure you get them. Many people do this electronically, which is easy for them and easy for the IRS. If you owe a payment to the IRS, you can defer up to $1 million as an individual. And the reason why we're doing $1 million is that covers lots of pass-throughs and small businesses, and $10 million to corporations, interest-free and penalty-free for 90 days. All you have to do is file your taxes. You'll automatically not get charged interest and penalties. Now, of course, any American has the right to extend their taxes. We're not taking that right, but the President has asked us to go up to $300 billion. That's also an enormous amount of liquidity in the system. The third thing is the President and I worked on a very significant economic stimulus plan. Thank you for being available last night and throughout this morning, and I will be presenting that to the Republicans in the Senate this morning and also discussing that with the House. We look forward to having bipartisan support. We're now working with the Senate to pass this legislation very quickly, and these will be payments to small businesses. We've talked about loan guarantees to critical industries such as airlines and hotels, and we've also talked about a stimulus package to the American worker. You can think of this as something like business interruption payments for the American workers. Thank you.
Do you have any questions for the Secretary of the Treasury?
When you say a stimulus package for American workers, do you mean direct payments to Americans, or are you talking about a payroll tax holiday?
Although the President likes the idea of the payroll tax holiday, I will tell you what we've heard from many people, and the President has said we can consider this. The payroll tax holiday would get people money over the next 6 to 8 months. We're looking at sending checks to Americans immediately. And what we've heard from hardworking Americans, many companies have now shut down, whether it's bars or restaurants. Americans need cash now, and the President wants to get cash now. And I mean now, in the next 2 weeks.
How much?
I will be previewing that with the Republicans. There's some numbers out there. They may be a little bit bigger than what's in the press.
Go ahead, please. Please, wait, please.
What help are you going to give to airlines specifically?
I've had discussions with all the airline CEOs this week. The airline CEOs have had conversations with the Senate and the House. As the President said, I was up with a subset of the Republican senators last night. I've discussed that with them. I think, as you know, this is worse than 9/11. For the airline industry, this is they are almost ground to a halt. The President wants to make sure that although We don't want people to travel unless it's critical. We want to maintain for critical travel the right to have domestic travel.
$60 billion, is that enough?
I'm not going to comment on the specifics. I will tell you, we're very focused. There's a lot of workers. This is strategically important to us, and we'll be working with Congress on this.
The airline industry will be in good shape. Yeah, go ahead, please.
There's been talk about $1,000 checks to every American, increasing support among Republicans and some Democrats for that. Would you support that going to everyone, or would you support some sort of income restriction on who gets a check?
Well, I think it's clear. We don't need to send people who make $1 million a year checks, okay? But that's one of the ideas we like. We're going to preview that today, and then we'll be talking about details afterwards.
In addition to airlines and hotels, you had a call with restaurants today. Was any type of emergency assistance discussed on that call? A lot of restaurants have to close. Even if they are doing delivery, they're not making as much money as they would with a full house.
Let me make two comments on the restaurants, and the President understands this. This was emphasized this morning. First of all, we want to make sure that the states allow the drive-through portion of these fast foods to stay open, particularly in a time period where we're telling people don't go to restaurants. These companies feed a big part of America, and I expect they're going to feed a bigger part of America. The second thing they asked me to emphasize, I wasn't going to do it now, but as long as you asked, many of these companies have apps. You can order ahead of time. That way, when you get there, it's as simple as they'll have it packed. They can give it to you with social distancing, and it'll be very fast. So we expect that they will be able to feed a large part of the population. And in regards to support, I will say a lot of these businesses are small businesses, are companies, franchisees, 500 or less, and we have a specific program we'll be unveiling that helps all businesses, small and medium-sized businesses of 500 and less.
Secretary, real quick question regarding Marriott Corporation. It announced that it is furloughing thousands of individuals because of the impacts of the coronavirus. Will your legislation help those individuals?
I hope so. That's one of the reasons why we got to act very quickly, because we understand whether it's the airlines, hotels, for good reasons to protect the United States on medical issues. These businesses are shut down, and the President wants to make sure, as I've said, we will use all the powers we have. You saw this today, $1 trillion of potential liquidity into the market, and the powers we don't have, we're going to Congress, and I will say there's a lot of bipartisan support for these issues. So I do want to comment on this, okay? We absolutely believe in keeping the markets open, okay? Americans need to know they have access to their money. After September 11th, the only reason why the markets were closed was because the technology was disrupted. I've been on the phone with the major banks, with the New York Stock Exchange. Everybody wants to keep it open. We may get to a point where we shorten the hours if that's something they need to do, but Americans should know that we are going to do everything to make sure that they have access to their money at their banks, to the money in their 401ks, and to the money in stocks. So I want to just be very clear, we intend to keep the markets open.
Our President directed us to work with the Department of Defense. There's two ways that DOD can be helpful in terms of expanding medical capacity. I know the governor of New York has asked us to look at the Army Corps of Engineers, which could perhaps renovate existing buildings. But the President also has us inventorying what you all would understand as field hospitals or MASH hospitals that can be deployed very quickly. We spoke with Governor Inslee yesterday in Washington State. We have resources in that part of the country that we could move. And as governors make these requests, we will process them, bring them to the President. But there are two different lanes that DOD can provide, in addition to many medical supplies to augment our national reserves. And the President has tasked us to evaluate, make available, and to consider every request from governors for either field hospitals, expanding facilities, or the Army Corps of Engineers that could retrofit existing buildings.
And as the President announced earlier, we are doing a dramatic expansion of what's known as telehealth for our 62 million Medicare beneficiaries who are amongst the most vulnerable to the coronavirus. And we're acting in accord with the appropriations bill that was signed on March 6th, as well as the President's emergency declaration last week. And this action is a part of our broader effort to ensure that government requirements, rules, and regulations don't get in the way of patient care during an emergency. And today's announcement builds on the significant progress that the President has already made over the past 3 years around telehealth services. And while we have allowed for virtual check-ins, full telehealth benefits have been restricted to those living in rural areas, established patients, and just for those brief visits. But no longer, Medicare beneficiaries across the nation, no matter where they live, will now be able to receive a wide range of services via telehealth without ever having to leave home. And these services can also be provided in a variety of settings, including nursing homes, hospital outpatient departments, and more. And thanks to the leadership of HHS, we'll also be temporarily relaxing certain HIPAA requirements so that doctors can provide telehealth with their own phones, and we'll be using enforcement discretion when it comes to collecting copays so that cost won't be a barrier. This is a part of our larger efforts around mitigation, and as we are encouraging Americans to stay home whenever possible, we don't want our Medicare policies getting in the way. And so consider the implications of this. Perhaps an elderly patient with diabetes needs a routine checkup, and this has nothing to do with the coronavirus. And so with our new telehealth benefits, this person who's not really, who's at risk for the coronavirus doesn't have to venture outside their home. They can talk to their doctor via Skype, and they don't have to risk exposure to the virus, and they can receive that care from the safety of their own home. It could be another Medicare recipient who's experiencing mild flu-like symptoms, and instead of leaving the house and sitting in a waiting room full of other vulnerable people, they can also receive advice from their doctor from their home. And this shift is very important for clinicians and providers who over the coming weeks will face considerable strain on their time and resources. And now Medicare patients who don't absolutely need to come in to an office won't have to, and this allows the healthcare system to prioritize for care for those that are that have more needs or in dire need, and preserves protective equipment as well. State Medicaid agencies can also provide telehealth services without federal approval, and so we're asking all states to make this available as well. And we've also asked private insurance companies to expand their telehealth benefits and make it clear to their providers and their members what they cover. As our nation seeks to balance the twin imperatives of getting Americans the care that they need during this outbreak and limiting the spread of the virus, the impact of this historic action simply cannot be overstated. In an emergency, those on the front line shouldn't have to worry about federal rules and red tape, hamstringing them when they need flexibility above all else. And we're doing everything in our power to make sure that that doesn't happen. I also just want to briefly mention that because of the President's emergency declaration, we do have the ability to provide a lot of Medicaid waivers, and Florida was the first state to be approved. We were able to do that in a matter of days.
Where do senior citizens go for instructions on how to do the telehealth?
They should call their doctor's office, and their doctor's office can tell them how to do that. Also, there may be some of our Medicare members that may not have access to equipment, so we're asking family members to help with this, but also respecting the requirements around social distancing, and if any of those family members or neighbors have symptoms, they should obviously stay
Will
away.
you be posting numbers also?
That's correct,
That might
exactly.
be the easiest way to do it.
Yes.
If you post in ads, if you post some numbers.
And they can also call our 1-800 Medicare number, and they can also get information. Those phone lines are open.
Well, thank you very much. As we talked about earlier this week, the commercial system is rapidly advancing in the testing capabilities. As of today, our public health laboratories, meaning the CDC and the public health labs, have reported out 31,878 tests, so almost 32,000 tests. The clinical laboratories, the Association of Clinical Laboratories, have reported out about 27,000 tests, and most importantly, of those 27,000 during the cumulative period of time, 8,200 of them were yesterday. This is showing the dramatic ramp as the high throughput comes in. We don't have the numbers this morning from the American Hospital Association, which means all the individual hospital laboratories. We will have that upcoming in the next day or so, and then Ambassador Birx will have this whole process fixed with the legislation that everything will roll up into a common reporting probably by the end of next week. In terms of our drive-through laboratories, again, these are blossoming all over the country by individual states. The ones that we are heavily involved in and really pushing equipment to, we expect over the next few days to begin setting up 47 of these in approximately 12 states. The material is already palletized and being shipped to the locations. Most cities have the specific locations. Some do not, but it's still going to a central receiving. And we know that we'll be deploying at least 140 Commissioned Corps officers. About half of the sites have reported their requirements. About 140 officers will be going. We expect that to go up. So this is going on the way we expected. We did a trial site yesterday with a full mobile unit for drive-through with full PPE. We had a lot of kinks in the system, as you can expect. That's why we do a test before we go out into the field. Don't expect these to be 100% perfect the moment they come. They're going to be adapted to the state and the local situation, but we're very confident that these will add testing to the already very robust healthcare system and commercial system. Thank you.
So I think what you've been hearing from us is to find solutions that are high quality and sustainable based on the frontline workers and governor's requests. And those come in on the governor's call. We've been immediately responsive to those. And that's the level of red tape and bureaucracy that we have removed. I think that point about sustainability and quality is very important because, as the president says, we're creating a roadmap for a different level of functionality for future pandemics. Our flu pandemic preparedness plan was a plan. Now we're seeing where we have to revise, where we have to create new avenues of research, new avenues of work to really ensure that the need of the American people can be reached. We were adamant about having a high-quality test based on our commercial vendors. Over the next few months, you will begin to see that other tests that were utilized around the world were not of the same quality, resulting in false positives and potentially false negatives. These tests were studied and studied by the FDA to really ensure that they are that level of quality, and we've given the states the permission to ensure that same level of quality. Now, I want to just say 1 minute on the testing. Testing should not be used as an assessment of your risk. We are asking every single American, no matter what your generation, from Z and up to X and millennials in between, to really ensure that you're following these guidelines. We hear every night of people who are not in work, moving that time into bars and other areas of large gatherings. If we continue with that process, we will fail in containing this virus. So every single generation has a role to play. We're asking our older generation to stay in their homes. And we're asking the younger generations to support them in social contacting through videos and other Skype-type functions, or just the simple telephone. We're asking the younger generations to stop going out in public places, to bars and restaurants, and spreading asymptomatic virus onto countertops and knobs and grocery stores and grocery carts. I heard an innovation last night and this morning again on the news. I really want to applaud the private sector who are now creating senior-only shopping times. I think that's extraordinary. I think that shows what America brings, and I think other countries will learn from us about how to really protect seniors in this type of way. I'm hoping that carries through to next year when we have our flu epidemic, where we can really have a very different profile of the amount of mortality that we have during flu that we never talk about. Anywhere from 15,000 to 45,000 individuals are lost every year. If we learn how to do this well and sustain some of those core changes, we can change the way respiratory viruses, not only for this, but the future, affect Americans.
Yeah, so a question on the clinical data. So we've had now roughly 5,000 people test positive. We've had 90 deaths or so. When are we going to know the data of who those people are? Who has been infected, what the ages are, what the pre-existing conditions are, how serious it was, both for those who have been tested positive, but also those who have died?
Well, you are singing my sheet of music. I'm very data-oriented, so thank you for bringing up this issue of data. I really want to applaud HHS. We had a discussion about this several days ago. They've made calls into Seattle and California to really understand that, and also importantly, to understand how many of their patients needed ventilators, how many of them needed oxygen support, how many of them needed and what they needed. Could we predict early someone who was going to have a more difficult course? These are all the questions we're asking and answering right now. We did get an early report back from Santa Clara and Seattle. We're digesting it. We just got it this morning. We're looking at that carefully because we think that roadmap is very important to other communities. We have not discussed this with New York yet. We do know from other countries, and that all is available online, that profile. You can see that mortality under 30 is extraordinarily low. The mortality across the board outside of Wuhan is now settling somewhere around 0.7, but that should not be reassuring because it's much higher in people with pre-existing medical conditions, even if young, and people that are older with pre-existing medical conditions. And so we still want every American focused on doing what they can do today to change the course of this
Will you
pandemic.
commit to making that data public so we will all know?
We're committed not only to making it public, but to have a website that everyone can see in real time.
Dr. Birx, if I could just follow up. You all are signaling a much more aggressive posture toward containment mitigation now. And many states have been very aggressive. But there is a small number of states that have not issued public guidance to their residents. Is it important for the success of the effort that 100% of the states be forward-leaning on this? And if so, Mr. President, what would be your message to those states that have not? Okay.
So that's why the Vice President and the President yesterday issued those critical guidelines. As I said this morning on Fox and Friends, you can look at them as guidelines, you can look at them as requirements, and you can look at them as the president asking every American in every state to follow those. That's why we put them out at the federal level. We wanted to make sure every American knew what they could do today to change the course of this epidemic. I think it's empowering. I think it says all of us have a social responsibility to each other, and that's why we believe that every mayor and every governor should be instituting these guidelines that came from the White House and the President of the United States.
Follow-up question on the testing. You've been telling us for days now that millions of tests have been sent out. So why have fewer than 60,000 people actually been tested?
I think you will see different numbers this week. You heard just at 8,000. Remember, all of these tests, the high-speed tests, were approved last Friday night, and last Thursday night. I think if I could talk to Thermo Fisher and the other groups that have these platforms out there, do not rely on a pull technology, push out those tests. Because we can only make them available, groups have to order them. So we've been talking to Thermo Fisher, one of the key platforms, to push out tests based on need and not wait for orders.
And is that where the issue is, getting the tests out, or is it getting the tests conducted?
That's a great question. I know part of it is getting the test out right now. I think the Admiral and others are working on getting the issues related to getting the test conducted. Obviously, that does take time. He is working on innovative solutions that are creative and sustainable, that will be a game changer in testing, but we don't have the data yet. This is a critical comparator. Can you do it yourself? Can you actually sample yourself? These are the kinds of things we're working on right now, and he's getting the data for us.
Can you give us a sense of how long these tough new restrictions will need to be in place until we start to see the rate of this virus going down? And also, can you speak to this study that as many as 2.2 million people in the United States could die if there weren't this type of action by the government taken? To what extent did that prompt what we saw yesterday?
I think, models are models, and they're based on input, and they're based on infectiousness without any controls. I can tell you we've never seen that level of infections that modeled up to that 2.2 million in mortality. So we are looking at that. We are having a particularly model meeting tomorrow. I think that's really going to be important. I've dealt with a lot of modelers in my time. They're wonderful people. but they all have their favorite inputs and they all have their favorite integration functions. So we're evaluating all of those so we can integrate and create the best model for the United States based on the best data. And that first set of recommendations you saw were based on what we could do today to prevent anything that looks like that. If I could just say one other thing to the hospitals and dentists out there. Things that don't need to be done over the next 2 weeks, don't get it done. If you're a person with an elective surgery, you don't want to go into a hospital right now. There's a lot of distraction. There's a lot of people doing a lot of other things to save people's lives. So let's all be responsible and cancel things that we can cancel to really free up hospital beds and space. And then let's do everything that we can to ensure that we don't need the ventilators because we protected the people who would have needed to use them.
Will the White House put any restrictions on corporate bonuses for companies that do get bailed out like airlines?
I think it's all a work in progress. What President Trump has made clear to industries around the country is that we're going to do whatever it takes. We understand this is an extraordinary moment in the life of our nation. It's the reason why the President brought in leaders of the financial sector, airline industry. He'll meet with all additional industry leaders today in tourism and hospitality. But he has tasked the Secretary of the Treasury to work with members of Congress in both parties to make sure that we construct the kind of economic support that will allow those industries to weather the period of the coronavirus and then to come back stronger than ever before.
Dr. Fauci, you've said you like being accused of overreacting because that is an indication we may be doing things necessary to beat this, bend the curve. How long do you think it will take for you to be confident that, yes, we're bending the curve, or no, we're not?
You know, I can't give you a firm number on that because the dynamics of outbreaks in some respects are predictable historically. They do this and that. We don't know because this is really unprecedented. I mean, of all the outbreaks that I've been involved with over the last at least 36 years and then going historically back, we've never had a situation where the mobilization of all the different components, travel restrictions, internal containment, mitigation, financial assistance, public health assistance, testing. So we don't really know. But the one thing I do know that if you look at models with all of their vicissitudes of models, is that when you have input into the kinds of mitigations and things that we're doing, we're going to see a hump instead of a peak. I would be really surprised if all the things that we're doing, and this is really a comprehensive approach. I was struck as I was listening to everyone make their presentations that, you know, I'm a scientist, I'm a health person, and I'm a physician who sees patients. So I look at it from one particular standpoint. But what I'm being impressed by is that this is really a comprehensive thing that has multiple components to it. All of them got to succeed if we're going to get to that end point that I've described multiple times from this podium. So I hope that if everyone does their job, we're going to be able to give you a number and say, you know, we've seen that inflection and we're coming down. I would hesitate to do it now, to be honest with you, because it might be misleading, and I don't want to be misleading. I just want to say one other thing, because I heard Dr. Birx say it, and I think we need to say it over and over again. When I was young, a long time ago, I felt that I was invulnerable, the way I think many of us feel we're invulnerable. And when we're asking the young people to help us with this mitigation strategy, by staying out of the bars, staying out of the restaurants, really trying to distance yourself, don't get the attitude, well, I'm young, I'm invulnerable. You are, well, in some respects, you're certainly less vulnerable than I am. However, what you might inadvertently do, and I know you don't want to do that, you don't want to put your loved ones at risk, particularly the ones who are elderly and the ones who have compromised conditions. We can't do this without the young people cooperating. Please cooperate with us. Thank you.
Dr. Fauci, and I'm going to read my notes so I get this right, but there's apparently a new study out of China. It found that the vast majority of cases, 86%, were in untested patients with mild to no symptoms. So What does that say about the impact of testing, and does it mean that testing should actually go beyond the sickest patients?
You know, that question keeps coming up, and I'm not going to evade the question, but I want to make a point. We tend to think that we're not going to be able to mitigate or contain without testing. They complement each other in some respects, but they're separate channels. Even if we had no testing, we should be doing what we're doing now. The question you're asking, so I won't evade it specifically, would it be important outside of a doctor-patient coming in together, of knowing what's out there, what might be under the radar screen? The answer to your question is yes. So let me tell you what the CDC is doing right now. They're going out there, and part of their program is to get a feel for what is there that wasn't initially thought to be coronavirus, that was thought to be something else. When you do that, you're also going to get a feel of what the penetrance is in society. So we are heading with the high throughput things that you've been hearing about to get an answer to your question.
Governor Cuomo said this morning he believes that we'll see a peak in terms of infection in 45 days. Would you concur with that?
You know, it's possible. I mean, I know that the governor has been really, I believe, doing a really good job of trying to stay ahead of this. 45 days is not unreasonable. You have to be careful. When you get a number, you own the number, and then if the number doesn't come out, you're in trouble. And that's the reason why, from our standpoint, from the federal government, we're talking about a range. So within that range, I mean, it isn't like you want to be correct for the sake of being correct, but you don't want to be wed to something and then have to back off.
Go ahead, please.
When is the soonest that we'll know that these new guidelines are actually bending the curve or actually working? And is there a point in time where you know, in the next couple of weeks, where you'll be able to tell the president more draconian measures are needed?
Well, okay, so what's happening, I mean, if you look as a metaphor, it's kind of like a race against the virus. If left to its own devices, we'll do this. And us trying to somehow blunt that. Now, you could see the virus going up and up, and your effect, your work, what you're trying to do, may actually be having an effect, but you may not see it because it'll still be going up. And as you're trying to implement your interference with the virus, you may not realize that you are actually interfering, and you'll say, wait a minute, it's still going up. What's going on? You've done nothing. But you don't know whether it would do this versus that. So the answer to your question, it probably would be several weeks and maybe longer before we know whether we're having an effect. It may be at the end of the day, we'll see a curve that would have been way, way up. But I wouldn't put us to task every few days. Well, wait a minute, it's going up. Is it working or not? That would be really misleading if we do that.
Go ahead, regarding the 15-day guidelines which were announced yesterday. One of those guidelines was a recommendation against gatherings of 10 or more people. And today, the governor of Alabama issued her own guidelines, and it was a recommendation against gatherings of 25
Right.
or more people. What is your recommendation for people of Alabama, people across all of the country, as far as the guidelines that were announced yesterday by the federal government?
Okay, so the one thing we don't want to do is to get hung up on the difference between 10 and 25. I think you might agree with that. When we give guidelines, they're only guidelines. We sit down, we look at the data, as Dr. Burke said, we're data-driven, and we say, on different models, 10 looks good. If someone wants to do 25, we're not going to fault them, but if someone wants to come to us and ask us what we think the best is, we stand by the numbers. It isn't perfect, it isn't precise math, it's assumptions and it's data that make you get your decision.
But would it be more effective if every state and every city in the country was playing by the same rules
Yes,
instead of
of
different?
course. But this is the United States of America. There's a lot of free enterprise there. People do their own thing. And quite frankly, I don't think there's a big deal difference between 10 and 25. We got many, many more important things to worry about than that difference.
Well, I think the question about the actions that the president's authorized, beginning in January, when he took the unprecedented step of suspending all travel from China, the efforts to issue travel advisories for portions of Italy and South Korea, and then to begin screening all the passengers. The efforts regarding suspending travel from Europe and what went into effect at midnight last night, adding the UK and Ireland to that, have all been informed by the experts that are surrounding us. What the President's asked us to do from the very beginning, as Dr. Birx and Dr. Fauci often say, is let's follow the data, bring the President the best options in response to what is actually happening on the ground. But with regard to yesterday's 15-day slow the spread plan, our team unanimously brought to the President these very strong recommendations for every American, because we truly believe we are at a point in this epidemic in our country when we can reduce the number of people that actually are exposed to or contract the coronavirus. But we'll continue to bring the best data, the best evidence, and the best recommendations, frankly, of the best health experts in the world, and the President will continue to make decisions that put the health of America first.
Well, I just said, Mr. President, before you leave, on what John was saying, you've called for people to leave politics out of this. Joe Biden said the World Health Organization offered testing kits that they had available to the United States, and to give it to us now, we refused it. We didn't want to buy them. PolitiFact says the WHO never made that offer.
Yeah, so I tried to cover this in the answer when I talked about quality of kits, and our quality analysis runs through the FDA. So all of these platforms, we have asked people to submit, and we've asked states to quality control. So, I mean, anybody could submit their test to us. We don't buy tests that haven't been quality controlled, and they show us the data. Either show us the data up front or show us the data after they've been running them. Because quality testing for our American people is paramount to us. It doesn't help to put out a test where 50% or 47% are false positives. Imagine what that would mean to the American people. Imagine their level of concern now and telling people that they're false positive. We take this same approach to HIV. Imagine telling someone they were positive to HIV and they weren't. So that is our bottom line, the customer, the American people first. And so any of these groups can submit their testing kits through our regulatory processes. But without that and without a plan, we are not going to accept tests that have not been studied by us.
I'm just going to emphasize a little bit more on that. When I became involved in the testing world, I called as senior officials at the WHO as I could find to understand what the situation was. And as far as I can tell from sources that should know, no one ever offered a test that we refused. This is a research grade test, right? Research grade test that was never submitted, not approved, not submitted to the FDA, that was supplied in tens of thousands of quantities to 100 countries in the world, okay? So I think there's a lot that people are saying about this that's just based on rumor and myth. Nothing was offered that we refused. It was a research test that was not approved. And again, there was a small number that we have greatly surpassed in a very short period of time.